The U.S. is approaching 300,000 COVID-19 deaths as cases continue to spike nationwide. More than 15.7 million cases have been confirmed, resulting in a new wave of lockdowns and restrictions. But there is some positive news on the vaccine front following an FDA panel's recommendation to authorize emergency use of Pfizer's vaccine. Final approval from the agency will jumpstart a massive effort to ship and distribute millions of doses to hospitals and drugstores across the country. For more now, I'm joined by Face the Nation moderator and CBS News senior foreign affairs correspondent, Margaret Brennan. Hey there, Margaret. So you're going to speak with Health and Human Services Secretary Alex Azar on Sunday. When does the Trump administration expect to start seeing people receive the coronavirus vaccine? And how are states and the federal government deciding who gets vaccinated first?
Well, if you take the Health and Human Services Secretary at his word, Alex Azar has publicly said he expects to see shots in the arms administered by Tuesday, maybe Monday of the coming week. When we have him on Sunday morning, obviously we will press him on any kind of updates because we still have not seen that formal green light from the FDA that allows for the process of loading the vaccine onto planes to distribute it to states all across the country. So we know that will take, 48, 72 hours or so. And we want to get an update from the secretary about that, how that process goes in those first few hours. But in terms of what happens and who gets it, that's really going to be up to governors of the states. The CDC has set recommendations as to who they think should be prioritized. But the federal government is really only in control of this process until they hand over the vaccine supply. And then it is up to the executives at the state level. So they can throw out the CDC guidance, they can amend it. And frankly, this is a big political challenge for all these governors who now have to decide, based on the number of doses they're given, who goes first, who goes last. Generally, the number and generally the category will likely first off be frontline healthcare workers, but even that gets complicated. And so we'll talk about that on Sunday as well with the head of one of the major hospital systems from Hackensack, New Jersey.
It's interesting how the Trump administration has decided the distribution in many ways mirrors the way that they've been tackling the coronavirus or their philosophy overall in terms of restrictions, lockdowns, et cetera. But Margaret, what's also interesting is, of course, that this vaccine distribution is going to be taking place in the middle of a transition. What more do we know about how the Biden administration will tackle the vaccine distribution on a much wider scale once the president-elect takes office?
We actually know very little in terms of the details of what Joe Biden, the president-elect, intends to do to alter the process that's underway. We've heard him publicly criticize the plan, though, as I learned last Sunday, when I asked Dr. Moncef Slaoui, the head of Operation Warp Speed, he said at that point Biden's criticisms were not informed by the actual process because he hadn't been briefed yet. So it will be interesting on Sunday to hear if we get any updates. Now that the two teams are actually in contact, has it changed Biden's criticisms? Because he's been on the record saying that when it comes to, in particular, the private sector role, because as you said in the intro, CVS and the Walgreens and the pharmacies who will ultimately help deliver this to the public writ large, that there is concern that maybe they don't have presence in certain areas of this country, tribal areas, for example, or in certain urban areas that don't have a really accessible CVS. What is the plan? When I asked the CVS CEO how they'd work around it, he said they'd set up mobile trailers. So there are a lot of details that I think we're all going to be seeing worked out in the weeks ahead. This is a huge political undertaking, and the Biden administration will be stepping into it with that process already underway.
Yeah, it's so interesting, all the minutia that matters so much in terms of how people actually get the vaccine and how they're able to keep it in that cold storage. Margaret, let's change pace a little bit and talk about federal unemployment benefits. As you know, they are set to expire for 12 million people the day after Christmas, unless Congress can pass a new COVID relief bill. things have not looked good on that for a while, but we do continue to hear these little drips and drabs about bipartisan groups working together. So where do lawmakers currently stand on those negotiations?
A week ago, there was a lot of hope. And then today, in the past 24 hours, that's really been put on hold. There were and have been some successful bipartisan talks in that it came up with proposals, actual bills to put forward. And what we heard from Senate Republican leadership is that that bipartisan proposal didn't meet the mark for Senate Republican leader Mitch McConnell, who wants to see a number of things. There's still a big standoff, for example, over the amount of money being given to state and local leaders in the near term. Republicans want to see that number come down or strictly, put guardrails on it so it can only be spent in specific ways. Democrats have said no, there is such a great need out there because of the economic crisis that there will be more government layoffs, for example, if states and local leaders don't get more financial aid. So these are the kind of details that are still sticking this process. And frankly, it's been stuck for months. Next week really does put a lot of pressure on lawmakers to decide if they are going to do something to extend the unemployment benefits that you mentioned that could, it's just unthinkable in some ways, be such an awful thing to have happen right around Christmas, as so many families we know are in increasing need.
Yeah, and to continue to have that deadline looming as these negotiations, and McConnell especially just saying outright, telegraphing to his members that Republicans were not going to support what was coming out of bipartisan negotiations. All right, Margaret, who else do you have on this weekend's Face the Nation that we should be watching for?
Well, we will talk about the rollout of the vaccine in specific terms. I'm really fascinated by this. How do you decide who's essential? Is it the bus driver who gets people to work? Is it the police officer? Is it the firefighter? Who goes first? Who goes last? We're going to talk about some of those mechanics with Dr. Scott Gottlieb, the former FDA commissioner. We will have Alex Azar, the Health and Human Services Secretary from the Biden team. We will have Cedric Richmond, who is currently a congressman and we know will be joining the administration as the senior advisor to President Joe Biden once he is inaugurated. And we will have a really interesting focus group I'm excited to bring you, talking to everyday Americans about what would convince them to take the vaccine, what apprehensions they may have, and what questions they still have. Because this vaccine, even once it's out there, is only as good as the number of arms it's administered into. And so getting public support is going to be so critical.
Absolutely. All right, Margaret, thank you.